Welcome everyone to our July session of Building Your Skills. My name is Lauren Harrington and I'm going to be your presenter today. Welcome to episode 12, Rights and Informed Choice. Today's presentation will be taking place over the next 90 minutes or so. So this is a great time to crack open your Diet Coke and kick back and enjoy the ride. We are currently using WebEx today. So once you've joined the meeting, feel free to connect your audio and use the appropriate connection method for your audio. I think this is a really cool option because if my Wi-Fi goes wonky, I can have it call me, which I think is probably the best option ever. You guys are all on mute as participants, and if you need to let us know any questions, comments, we will be using our Q&A panel, but we do prefer that these are, of course, used for questions. So if you're going to use a question or use the Q&A panel, going to ask a question, gosh, it must be Wednesday. If you're going to ask a question in WebEx, please make sure that your Q&A panel is having the ask set to all panelists, which will enable all of our panelists who are working diligently behind the scenes to find the answer to your question to do so. All of our panelists will be able to see you and your questions, but the rest of our participants will not. If you have comments, we would love to hear them, but please share those in our survey, which we will share the link to at the end of our presentation today. The Q&A panel, we would prefer that you use that to ask questions. All right, here's our agenda for today. We are going to share an announcement or two, talk a little bit about our survey results from last month, and then get into the meat and potatoes of episode 12, our rights and informed decision-making presentation. So a couple of announcements here as we move forward. Effective July 1st, 2023, case managers must complete 20 hours of education and disability-related training each year if they work with a person who uses either the BI, CADI, CAC, or DD waiver. This is an increase from the previously required 10 hours per year. Case managers can complete the 20 hours of training annually by calendar year or annually by hire date, according to their lead agency. I just realized that I am not sharing the appropriate screen. Sorry about that. I think I've got it going now. All right. Excellent. The 20 hours of education must now include person-centered planning, informed choice, cultural competency, employment planning, community living planning, self-direction options, the use of technology supports. Any of those must be included in your training. This legislative change also requires case management to complete an employment planning training course by August 1st, 2024. For case managers hired after August 1st of 2024, they must complete that employment training within the first 6 months of providing case management services. DHS will provide information about how to access the one-time employment training in the future. We do have some recommended trainings on our DHS Case Manager and Care Coordinator Toolkit. So you can take a look at that. Also, to give you some more information about informed choice related to benefits planning. To help ensure informed choice, the legislative changes require that case managers offer all working age people with disabilities benefits planning assistance and support so that they can understand the work incentive programs available to them and the impact of work on their benefits. Lead agencies can authorize benefits planning under employment exploration, employment development, and employment support waiver services. There is a link on the PowerPoint that was sent out ahead of time to the legislative changes to case manager training requirements and benefits planning e-list that was sent out on July 5th. So for more information, take a look at the CBSM under Employment Exploration, Development, and/or Support. And again, that e-list is linked on this slide. You won't be able to just click your screen. You'll actually have to open up the PowerPoint that was sent out to you all prior to this presentation if you did register. So do let us know if you have any questions about that. Okay, moving right along. Let's talk a little bit about our June survey results. Well, we made a big mistake. We did not put a survey option for a June of 2023 date in our survey. It still had only our 2022 dates in the survey. So we have now added our 2023 dates into our survey. So when it does automatically pop up at the end of our time today, include any comments from last month or any comments from this month, of course, in your response for July 2023. We did receive a response from one very persistent survey user who chose June 2022 and then advised us that we didn't have our 2023 dates in there. Thank you. Thank you for your input and also your tenacity in getting that survey back to us. So we really appreciate it. Hopefully you guys can all fill out your surveys after today's presentation, and we will have survey results for you next month. So getting into our Building Your Skills series. Just a reminder, today we are going to be continuing in our Building Your Skills, Developing a Support Plan series, which was developed because we heard feedback from case managers, care coordinators, assessors, supervisors, that you are looking for training on developing a support plan. And so that's who this training is really intended for, those folks who build support plans. We really do intend to use these meetings to pilot topics that are related to building a support plan and also to gather questions so that we can create online modules based on the information we presented, your questions, and your feedback in our surveys. This training is foundational. We begin at the basics. This is very basic level training, and we hope to use this as a foundation, as we said, for future training and kind of taking it to the next level. We are going to try something a little bit different today with our introductions. I will ask our fellow team members who are assisting me as panelists today, when it's your turn, to turn on your cameras and also to provide an accessible description of yourself for those who may need an accessible description. Let's take a look here. I will start. My name is Lauren Harrington. I use she, her pronouns, and I am a white woman in my very late 30s. I have shoulder length blonde hair, and I'm wearing an orange short sleeve sweater. I am sitting at my desk and have a background of a lovely tree filled window. And I would love if my co-panelist, Megan Molumby, could come on camera and introduce herself.
Hi, everyone. I am Megan Molumby. I use she, her pronouns. I am a white woman in my 30s. I'm with blonde hair that's pulled back into a clip, and I'm wearing glasses and a large headset. I have on an orange shirt. I'm sitting in my office and have a few plants behind me. I am Case Management Policy Specialist with the Disability Services Division. Thank you.
Excellent. And next, Sarah Shane, if you could come on.
Hi, everyone. My name is Sarah Boshen, and I'm a white female in my very late 40s with dark blonde hair, a side ponytail, and I'm wearing glasses and a green shirt today. I am the Informed Choice Policy Specialist at the Aging and Disability Services Division, and welcome to our training today.
Next, we have Victoria Stelfox.
Hi, my name is Victoria Stelfox. I use she, her pronouns. I'm the support plan policy specialist. I'm a white female in her 40s, wearing a blue shirt and highlighted blonde hair. I will leave it to Jill next.
Thanks, Victoria. Jill? Jill, if you are speaking, you are on mute.
Thank you. Hi, I am Jill Tilbury from the Disability Service Division. I am the Public Guardianship Administrator. I use she, her pronouns. I am a white female in my mid-40s with my hair pulled back, and I'm wearing a blue shirt in a very small little room that is my office. I look forward to having this great discussion today. Thank you.
Thank you all. And to preserve bandwidth, feel free to go off video. I will likely also go off video because my Wi-Fi is being a little wonky. All right, well, thank you all for helping us to try that out. Our other presenters today, Andrew Johnson and Kathleen Vondrum, are unable to be with us. So they are definitely a part of planning and getting this presentation ready, but they are not here on the call today. Moving forward, I know I talked a little bit about question answers, but let's just double check. We are going to be taking questions today over the Q&A panel in WebEx. Use that Q&A panel to ask any questions that you might have, and use the survey to provide any feedback that you might have. Again, if you set your ask button in the Q&A panel, those questions are visible to the panelists. If you set them to all panelists, and they are visible to the panelists only. If your question's not answered during the webinar, send your questions back to us using those appropriate division contacts, which we've got here on the screen. You know, we may have some time constraints, so we will only be able to respond to questions that directly relate to the content that we're covering. Questions that don't directly relate to the scope of today's training, or that might be more situational, we're not going to be able to address here. So address those definitely to the appropriate division contacts so that we can help you out and get answers back to you quickly. All right, let's get started here. Episode 12, Rights and Informed Choice. So if you have missed a previous Building Your Skills episode, we want to just kind of remind you of the things that we've talked about. So far in our episodes, we've talked about the assessment process, the assessment results, and also how they impact the planning process. We've talked about specific information to gather and review to help you prepare to meet with the person. We've talked about researching and gathering information about service and support options to help that person make an informed choice about their available options. We've also talked about what information to share with the person to prepare them for their role in building their support plan. We've also talked about support types. So the concept of people and community, assistive technology, and services while building support plans. We've talked a little bit about consumer-directed community supports, or CDCS, as well as own home and provider-controlled options for the people that we serve. And we've talked about informed choice requirements and those requirements' importance to the people that we serve. Again, if you've missed a previous Building Your Skills episode, or if you've got new staff that should be taking a look at these before they are out on TrainLink as online modules, you can find recorded copies of these presentations on our training archive page. There is a link to our training archive page on the resources slides at the end of this presentation, but I always get there by Googling Minnesota DHS Training Archive, and it's the first link that pops up. So scroll down on that page to the Building Your Skills section, and the list of trainings that you can review should be there and posted. This presentation will also be posted in the training archive at the end as well. So our learning objectives for today: when this training is complete, you will be able to examine the rights of people of all ages and abilities, outline the rights of people of all ages and abilities under guardianship, describe the concept of dignity of risk, and explain the informed decision-making process and how it's used to support a person in their decisions. We also want to talk about this concept of informed choice becoming more critical the more dependent a person is on their services. And so note that in this presentation, we're going to talk about the person, and we really mean that person who's receiving services. We know that some people make decisions with support from their families or their legal representatives, but in this case, we're going to be talking about the person receiving services. So moving us forward into our first section on human rights. So when thinking about the people that we serve, we all know that our work is really seated in our aims to change attitudes and to change approaches to persons with disabilities, as well as people who may be aging. And we are working to change that view that people with disabilities are objects, objects of charity, objects of medical treatment and social protection, to influence society to recognize that those people have rights and they are capable of claiming those rights and making decisions for their lives based on their free and informed consent, as well as being active members of society. And that is taken largely from the United Nations Convention on the Right of the Persons with Disabilities. It does also apply to folks in the aging population as well. And so that is really our aim in the work that we do every day. Also, equally as important is our 14th Amendment of the Constitution. And though we all share the value of the people that we're working with having rights and choice, and that they're not objects, they're people who fully participate in society, it can be forgotten as we work with people. But all of the rights that individuals have are all of the rights that we all have as citizens of the United States. That 14th Amendment in particular impacts our work in human services. So it says that all persons born or naturalized in the United States and subject to the jurisdiction thereof are citizens of the United States and of the state where they reside. No state shall make or enforce any law which shall abridge the privileges or immunities of citizens of the United States, nor shall any state deprive any person of life, liberty, or property without due process of law, nor deny to any person within its jurisdiction the equal protection of the laws. DHS has also added an additional layer on top of this, and that's really working with people in a person-centered manner. That's something that we take equally as important as a person's rights. In the work of human services, the right to be protected from harm is often made into our main goal. So protecting the people we work with from harm of any kind. However, we can't forget that our responsibility is to treat people with a person-centered focus. That means respecting the person's right to take risks, as well as the need to have self-determination and autonomy through informed choice. Focusing on that person as an individual with the same rights as any other American will help the people that we work with to have their services meet their needs more directly. In the United Nations Declaration, in their Convention on the Rights of Persons with Disabilities, they identified a basic human right that we don't necessarily always recognize as a human right, but it's communication. And communication really is fundamental to all aspects of life. It's our foundation for learning, and it's vital for the quality of life. So thinking of communication as a human right, thinking of how that impacts our work, effective communication is the cornerstone of informed decision-making and informed choice. It enables a person to say yes or no. It enables them to be heard and understood. It facilitates trusting relationships and helps a person to make requests and suggestions about their services. Really, communication is what empowers a person to participate fully in their communities. As a reminder, please go ahead and enter any questions that you might have into the Q&A panel as we proceed. We'll be stopping a couple of times throughout our presentation to answer them. But this is just a kind of reminder that you can go ahead and put those questions in the Q&A panel, and our team behind the scenes will be working to assign them and to answer them. So let's talk a little bit more about rights of people. So what about the rights of people under guardianship? What rights do they have? So the Bill of Rights for persons subject to guardianship or conservatorship, having a hard time today, states that the person subject to guardianship or person subject to conservatorship retains all rights not restricted by the court order, and these rights must be enforced by the court. And that's in Minnesota statute. You can see that link there as well. A list of what rights that are included in statute language is also listed on that link. So feel free to click that for further review. So when working with people subject to guardianship, it's necessary to know what the court order states for each individual, as the guardian may not be allowed to make all their decisions. Even though a guardian has been appointed, the person still retains their rights as outlined in this statute. Again, take a look at the statute language for a list of those rights for further review. It includes things like treatment with dignity and respect, due consideration of personal desires and preferences, participation in decision-making about healthcare and treatment, and especially the right to exercise control of all aspects of life unless delegated specifically to the guardian or conservator by court order. So what does this mean? A person under guardianship has all of the rights that you and I have, unless they are specifically restricted by the court orders. So we don't want to assume that just because a person has a guardianship or is under conservatorship, that that guardian or conservator will make all of their decisions. Make sure that you're reviewing those guardianship orders so that you know kind of where that line is. So what if the guardian and the person disagree? We know that this happens. We know that there may be disagreement with the guardian and the person, or the person's family and the guardian, or any combination of those. It's our job to find a balance. It's not just doing what the person wants or being a mouthpiece because you're the support planner. It's your responsibility to weigh the person's choices and preferences, capacitated or not, weigh that against harm. This diagram is kind of cool. If you think about this balance between 2 and 4 and really what that means, the guardian needs to review the wishes of the person or their family and work within the scope of the guardianship order that's provided by the courts. So, for example, if we have a person who's resistant to receiving home care and really feels that it's important to stay in their home full of memories, so kind of balancing, they don't want home care, they're resistant to it, and they want to stay in their house full of memories. Balancing that, you know, with what might be good and healthy or safe for them. Another example, a person states their desire to stay home, but they're also extremely private and they don't want someone sitting in their house with them all the time. So thinking about the balance between that as well. Often, the guardian is thought of as the person who can make the move or put something in place to solve that conflict or make that ultimate decision. But the guardian really needs to focus on balance. The person may be only focused on what's important to them, and that focus may increase resistance to effort to maintain what's important for them. So instead of turning it into like a power and control issue between all members of the person's team, your role as a case manager or care coordinator is to help sort through the ways in which addressing the things that are important for the person, their health, their safety, law compliance, etc., could help maintain what's important to them through their own informed choice. Now we know that we're just touching our toes into these areas. But as a reminder, any questions that you might have about what we may have covered so far, enter those into your Q&A panel. Make sure that your ask is set to all panelists, and our team will be working behind the scenes to assign them and answer them. So we brought up a concept about a person's right to take risks. This is also referred to commonly in the disability and aging services world as the dignity of risk. As case managers and care coordinators, we're constantly thinking about protecting the person's health and safety. But what happens when our well-intentioned efforts to ensure health and safety is our only goal? Dorothy Stauber, who is a parent advocate, captured a life without choice and control in her poem called The Dignity of Risk, the text of which is on our slide. So what if you never got to make a mistake? What if your money was always kept in an envelope where you couldn't get it? What if you were never given a chance to do well at something? What if you never got to make a decision? What if the only risky thing you could do was to act out? What if you worked and only got paid 46 cents an hour? What if you grew old and never knew adulthood? What if you never got a chance? This is another great quote about rights and taking risk from Robert Pirsky. To deny the right to make choices in an effort to protect the person with disabilities from risk is to diminish their human dignity. And the same can be applied to a person in our aging population as well. People have the right to choose. They have the right to choose the services and supports that they want in their life. And that is the dignity of risk. It's the belief that taking risk is critical to a person's self-determination and that all people have that right to make their own choice. People have the right to practice self-determination and live the lives that they want to live, lives that are meaningful to them. People have the right to choose their services and supports. And again, all people have the right to take risks. So what can we do? Remember that choice is a basic human right. Case managers and care coordinators are critical supports for a person to ensure that the person is offered choices and that their choices are heard. Case managers and care coordinators must encourage the person to make informed choices and their right to take risks by doing things like promoting the independence of the people you support, recognizing that people have the right to take risks, and offering support options to the person, even if other members of the support team might resist. When the person makes a choice that includes risk, you must discuss each risk through the informed decision-making process, which we're going to be talking about in more detail today. Work with that person to develop a plan that both meets the person's needs and wants and also addresses any identified risk. And address the risks within the support plan. This doesn't require you to eliminate risk, but it does it rather manages the risk. So again, options about support must be discussed with them as well. So for an example, if a person wants to meet an assessed need independently on their own, have discussions about a backup plan if the person should require additional support. Maybe that person wants to manage transportation to and from work on their own, but there might be a risk that the person might not show up to work or may get stuck at work without a ride home. In those situations, the case manager or care coordinator would discuss the risks with the person and develop a backup plan. So for example, ensuring that the person has their phone, designating specific people they could call if they're stuck at work or specific people at work that they could ask for help. All options should be explored with the person about options to ensure that the person has choices about the way in which they want to be supported. We have a really fantastic resource to support having conversations about informed choice. That's called the Guide to Encouraging Informed Choice and Discussing Risk. It's linked on this slide. It's also linked in our resources section. And in that resource, it talks about the case manager and care coordinator role and what they must do. Their responsibilities are to problem solve by discussing the risks and benefits of available options, addressing any concerns that the person or their team might have, and considering strategies to overcome challenges. It's also your role to advocate for the person, be a champion for the person's preferences and their right to take risks with their choices. At this point, we do have a break penciled in to answer any questions that may have come in the Q&A panel. Remember that the Q&A panel is located at the bottom right of your screen, and you can go ahead and type your questions in there addressed to all panelists. I'm not seeing any questions at this point, but I will take a break to pause for any that might come in. Fellow panelists, did I miss any questions that may have come through?
Hi, Lauren. This is Megan. We do not have any questions yet. So if you do have questions, go ahead and type them in that Q&A, and we'll keep monitoring that.
Excellent. Thanks, Megan. Well, let's get into considerations for informed decision making. So we really wanted to just provide a quick foundation of what our rights are, what people's rights are, and what the concept of dignity of risk is. And now we want to look more closely at informed decision-making requirements. We promised we'd talk about these in June's Building Your Skills, and now we are. So talking a little bit about informed decision-making. This isn't really an ordered process, although you will see on a couple of slides that they're numbered. Really, it's identifying where the person is at in their decision-making process and addressing the appropriate concerns that they may have. And also ensuring that all elements are taken into consideration. So we're going to take a look at these considerations in hopes that it gives you a roadmap in supporting people to make informed choices. So we have learned that informed choice is a right that people have, and we've learned a lot about why that's important. In state statute 256B.4905, which we also call the HCBS Informed Choice Policy Statement, there are some requirements outlined that ensure people are supported in an informed decision-making process. Those requirements, which are aspects to address during decision-making, fall into 4 categories. And those are identify needs and address barriers, provide information and experiences to explore options, planning for transitions, and documenting options explored and choice. Let's get into those a little bit. We'll start with identifying needs and addressing barriers. So first step is to provide information about the person's rights. When people access services, they're not always aware of what their rights are, and our job is to actively take steps to provide information to people about their right to informed choice. So taking steps to ensure the person is aware of their role as a decision maker in their life. Also ensuring that the families understand that their role is as a support. They are there to support informed choice, to support autonomy and human rights of the person that they are working with. And ensure a person's ability to grow, learn, and change. You want to make sure to honor that ability as well. Next, in identifying needs and addressing barriers, we would want to explore that person's own preferences, their abilities, their goals, and objectives. And third, we would want to identify and gain awareness of the person's cultural needs and provide access to culturally responsive services and providers. Let's take a look at some examples and approaches. So when we work with people who have a culture and value system that's different from our own, it's crucial to take a few steps into consideration. So take the time to learn about them, be responsive to their preferences, and demonstrate understanding. Become aware of individual culture and identity and how supports will honor preferences in areas like a choice of provider, cultural and religious beliefs, customs, daily practices, holidays, food, personal cares, privacy norms, socialization preferences. All of these things that may seem small are preferences that the person might have that they need to have addressed in a specific way based on their culture and identity. So we want to ensure people receive information about culturally responsive and culturally appropriate services, as determined, of course, by them. We want to understand their needs and support communication with their provider about their preferences and choices. Many people with disabilities have experienced discrimination, including people from other marginalized communities. They may not believe that government programs will work for them. So we want to acknowledge their experience if they share it, and also to affirm their right to equitable treatment. And also be mindful that the negative experience people express are real. When there's a shortage of diverse providers, some things to consider. looking towards trusted community resources to support the person in the ways needed. Also, remembering that planning includes planning for informal and formal supports. Think about pointing providers to DHS or other grants that support building capacity for diversity. And if a culturally specific provider is not available, ensure the provider is aware of that person's needs and help the person advocate for those needs and preferences. Here's an example. A concrete example is identifying needs and addressing barriers for people who are affiliated with a tribal nation. Keep in mind that Minnesota exists along with several sovereign nations. Many tribal governments administer waiver funds, and many tribal governments are providers of home and community-based services. They may or may not be the same that administer waivers. If you want more information about that, learning about which nations are enrolled providers, you can take a look at minnesotahelp.info. But as dual citizens, tribal members have a choice between tribal management and county or health plan management of HCBS. And they also have a choice of tribal or other providers. Tribal members also have a right to choose tribal providers that meet provider standards for the service that they're providing. So remember, this is crucial to providing informed choice to people affiliated with a tribal nation. When identifying needs of folks who are affiliated with a tribal nation, know that the following tribal nations do administer HCBS: the Leech Lake Band of Ojibwe, the Red Lake Band of Chippewa Indians, and the White Earth Nation. The U.S. Code of Federal Regulations states that Indian Health Services is the payer of last resort when other resources are available. Don't let payer of last resort confusion become a barrier for people accessing services. Authorize waiver services for assessed needs prior to having the person look to IHS, and authorize the tribe to provide services if that's the person's preference. So, for example, if a tribe provides home-delivered meals and it's also available under their government's IHS funding, the waiver should be authorized and pay the tribe for providing that service. So next in addressing barriers, we want to talk about addressing barriers to a person making an informed choice. We also want to authorize services and supports necessary to overcome those barriers. We're required to provide reasonable accommodations as needed or requested by the person to fully participate in the informed decision-making process. Remember, we discussed all people have a right to communicate, be heard, and express their opinions, preferences, and understanding. Addressing barriers and providing accommodations is key to ensuring that person's rights. So let's take a look at some examples. So to provide reasonable accommodations, we want to understand and learn about the person, how they communicate, how they receive information. Think not only about their disability, but also about different learning styles. We want to also offer flexibility and support for scheduling meetings, tours, interviews. We also want to offer support on how to navigate websites. Seek continued education about supporting people with complex communication needs. That will help us to discover and learn more as we grow. It may mean facilitating assistive technologies and formats to meet a communication need. The case manager provides information about assistive technology assessment. So also which, if any, technology can reduce barriers, promote their personal expression and informed decision-making. You may find a person experiences more involvement in their choices after learning new assistive technology. When a person uses new assistive technology for communication, that would be a good time to revisit some important decisions. We also want to provide information and experiences to help that person explore options. We want to present and discuss all available options, at least annually, and when the person is requesting supports or making a transition in life. People are to be offered information about all available services. There are also specific requirements for the following services. So employment and benefits planning, supports and options available for living in one's own home, assistive technology and remote supports, and self-directed services. A person's choice to not work and to live in, excuse me, sorry, I didn't mean to flip there, to live in a provider-controlled setting should be revisited regularly. Informed decision-making is an ongoing process and continues over time. And remember that every person should be given these options, and every person should be offered self-direction before they're offered services that aren't self-directed. One example we've been made aware of includes providing options when people or the person's family states that their preference is a facility or institution that's more segregated, or states that their home and community-based services, don't support them. We often get the question, well, what if people want to choose a congregate living arrangement or something that leans more segregated or institutional in nature? Our answer is that Minnesota will always look at services through the lens of community integration based on federal and state law, also including the Olmstead precedent. Segregation is not legal and not allowable in home and community-based services, so public funds are used to support a person in their own home first when possible and to the greatest extent possible. The next step would really to be discuss provider-controlled options if community residential supports are needed. In summary, informed choice in home and community-based services is is based upon available integrated services. People have choice from within their available options. If providers are not available to meet certain needs, that shouldn't prevent assessments or planning or looking for alternatives. Emergency backup planning will be your key planning tool for when there is a staffing shortage. We want you to document all options provided and discussed and documents needs that are not currently being met by HCBS. We do have a pretty great guide for this as well. Consider informal supports and take a look at that guide. It's linked here on the slide, the Guide for Emergency Backup Planning. We also want to encourage formal, facilitated, person-centered planning to look closely at the person's goals and explore unique strategies and plans to meet those goals. Next, we're going to talk about experiential learning and facilitating opportunities to meet with other individuals with disabilities who live, work, and receive services different from the person's own services. So you can continually encourage people to try new things. Learn what would help that person gain the experience needed to decide about all services, including things like meaningful employment, independent living, and assistive technology. Experiential learning might look like facilitating intentional experiences for people to allow them to take initiative, experience new learning, make connections, solve problems, learn about risk and responsibility, apply past experience and knowledge, and make decisions and be accountable for their results. We want also to explore and develop new options when people can't find providers that are a good match for their needs and preferences. You may want to explore in these cases individualized options like customized employment, life sharing arrangements, assistive technology, or remote supports. You can also explore encouraging a provider to begin offering new services and supports. We also want to discuss the benefits of individualized and inclusive supports. This is related to the culture of long-term services and supports. Minnesota strives to help people live as independently as possible so that they can continue to be a part of the communities in which they live. An example is talking positively to transition-age youth about meaningful careers and living independently. It could also mean encouraging family members to discuss the benefits of individualized and inclusive supports with their family member receiving supports. Our next consideration is providing timely opportunity for a person to make decisions. We want to ensure that people are given timely and accurate information about timeframes that might impact their decision making. We also want to encourage and allow them to take enough time to fully consider options. And this timeframe will differ among people. We also want to let people know that they can revisit decisions and outcomes at any time, and that they can always ask for more information to continue to evaluate their options. And we want to plan for transitions. Develop a transition plan, either when it's needed or when it's requested by the person, to facilitate the choice to move from one service type to another. We want to provide information about relocation and transition services that might support their plan. And we also want to authorize services and supports when necessary. Transitions can look like when a person is moving, including moving out of an institution or a hospital or a community residential setting. Do keep in mind the required My Move plan and ask the person what level of planning and support they'd like to receive. It could also look like a person receiving a service termination, or when someone reaches milestones like turning 18, or when they reach a personal milestone. A transition could even look like when the person asks for support, or when they lose a loved one or a caregiver. So keep an eye out for those. Sorry, I didn't move the slide fast enough, but yes, transitions look like that. We also want to document options explored. And documentation is really important as it ensures the integrity of our process. So document how you've ensured an informed choice for the person, including any options that you talked about, any experiences that the person may have tried, and the person's choices resulting from those. So it helps to prepare yourself to engage with that person. It helps to support voluntary decision-making and then work together to overcome barriers. Use and provide digestible information. So what that means is avoiding jargon and breaking down information into smaller pieces. You also want to check with that person that they understand, allowing that person to demonstrate or express their understanding in their own way. Also, be aware of the person's relationship with decision-making and encourage their growth in decision-making. Understand that it's a process. Some things that can hinder informed choice. When efforts are limited to providing a list of options, if you just hand someone a list, that's hindering informed choice. Checking off boxes on any form without ensuring that the process has integrity. Limiting yourself to yes or no questions and then stopping there. Not revisiting or reflecting on the outcomes of the decisions that the person might have made. And when information is given in an inaccurate or an incomplete way. All of those things can hinder a person's informed choice. Again, what if there's disagreement? Well, we want to acknowledge the good intention of family and other supports. Reaffirm that it's the person's choice and it always will be the person's choice. They are the one that will be living with their decision. Remind the person and their families that decisions such as not working and living in provided control settings will be revisited regularly. Talk about paid caregiver or paid family members' roles in providing informed choice and supporting that person's independence and growth. And remember, when a person is supported by a guardian, the person must be consulted and their wishes reflected to the greatest extent possible. Guardians have a responsibility to provide informed choice and to support informed decision-making. We've got some excellent guides that support conversation and informed decision-making here. Linked here are the Tools for Inclusion by David Hoff at ICI at the University of Massachusetts, Boston. We also have linked here Mainsill's Facilitating Choice Guide and SELN's Guidance for Conversations. A couple of these tools are focused on employment, but you'll find that the conversation tools can be applied to really any conversation. Two of these tools even have helpful worksheets to walk through decision-making with a person. So some really great resources there. This is your reminder that if you have any questions that were brought up by the previous section, to type those questions into the Q&A panel. Remember that your ask needs to be set to all panelists, and we can get our panelists working behind the scenes to answer your question at our next question break. So let's talk a little bit about how and when to have informed choice conversations. We're going to take a look at some examples of when you have to support a person's informed choice. Know that this, ensuring an informed choice is an ongoing conversation, and that what we're describing is the bare minimum. So when? Informed choice conversations should take place at any assessment, but especially first during the person's annual assessment. At this time, the assessor is responsible to provide knowledge of the person's basic rights and due process, or appeals, ask informed choice questions located within the MnChoice's revision section, functional assessment self-determination. And those questions are, and these are kind of worded a little oddly for a presentation, but we wanted to give you the exact text of those questions. The person's capacity to direct their services, yes or no? This question refers to the person's ability to understand, communicate, and choose options for themselves, not self-direction. If they are unable to direct their own services, who will assist that person? Does the person choose to pursue consumer-directed options? And does the person choose to stay or return to a disability waiver? And if so, which program does the person choose to stay on? Some additional questions from that section. Does the person want to reside in an institutional setting or within the community with services? We ask this question regardless of where the person's currently living. What type of community setting does the person choose to live in? Did the person receive, oh, I flipped too fast as well. Sorry about that. Did the person receive information about all of their housing options? Does the person want to work in the community? What type of work setting would the person like to work in? Was information given to the person about all of their working options? And along with asking these questions from the MnChoice's assessment, it's important that the assessor documents the person's needs and their wishes within the assessment summary. Another opportunity to discuss informed choice and have those informed choice conversations. Again, anytime support planning is done, but especially at the annual support plan meeting. Case managers and care coordinators must use the support planning signature sheet within the MnChoice's application to discuss and document the following questions. Were data privacy practices explained to me, and was I given a copy of my data privacy rights? Was I given Minnesota Healthcare Program DHS 3182 brochure? Were my appeal rights explained to me, and was I given a copy of my appeal rights? Was I given choice between receiving services in the community or in an institution? And was I able to invite who I wanted to come to my support planning meeting? Remember that person-centered support planning is not person-centered without informed choice. A person's choices are really the heart of person-centered planning. So some questions that continue within MnChoices. Was I able to participate in the developing of my support plan for receiving services? Was I given choices of my different types of services, housing, employment, and employment support that could meet my assessed needs as indicated in my assessment, and have a thorough discussion with my case manager? Was I offered a choice of all available services, supports, and providers? And do I agree with the services, supports, and providers indicated in my plan? The most important question of those really is, was I given choices of different types of services, housing, and employment support that could meet my assessed needs as indicated in my assessment, and have a thorough discussion with my case manager? We really want you to reflect on what those questions might mean. So think about how you can have meaningful discussions to ensure that the person understands these questions. Think about all aspects of informed decision-making and what that means. Remember, presenting options so the person understands their available options. Talking about the whole person, exploring options through experiential learning, identifying, discussing barriers and necessary supports. Also providing timely opportunities for the person to make a choice and supporting them through transitions. Really think about what it means for someone to say yes to these questions. Case managers and care coordinators need to make active efforts to explore all possible opportunities to enhance a person's informed choice. Document all of those efforts within the person's case notes. So informed decision-making and informed choice not only takes place at the assessment and annual support plan, but it's an ongoing process that happens throughout the year. It happens through engaging person-centered conversations and activities. It's really circular, and it doesn't occur just one time. It's an ongoing process. Informed decision-making and informed choices are a key part of making a support plan. So if the person expresses any desire for different waiver services, different housing, employment, or community activities, case managers must make active efforts to accommodate the person's wishes. Remember that those conversations should happen regularly and they should always be at the forefront of the case manager's mind. It is vital. Informed choice and informed decision-making becomes more critical the more a person relies on their services. And as we've explored today, choice and autonomy is vitally important for all people. And for people who are more dependent on caregivers in the system, we need to make additional efforts to ensure their right to autonomy and choice. So we wanted to summarize this process in a list form for easy reference. It'll be on this slide and the next. And we're also working on a CBSM page that will also contain the same information. So just to kind of summarize, to identify needs and address barriers, we must provide information to people about their right to informed choice. We must discuss a person's own preferences, abilities, goals, and objectives. We must identify and gain awareness of the person's cultural needs and provide access to culturally responsive services and providers. We must address barriers to a person making an informed choice and authorize the services and supports necessary to overcome those barriers. And we must provide reasonable accommodations as needed or requested by the person to fully participate in the informed decision-making process and acquire the information necessary to make an informed choice. Also, we need to provide information and experiences to explore options. So we need to present and discuss all available options. We need to explore experiential learning and facilitate opportunities to meet with other individuals with disabilities who live, work, and receive services different from the person's own services. We also want to explore and develop new options when people can't find providers that are a good match for their needs and preferences. We also want to make sure that we're discussing benefits of individualized and inclusive supports and provide timely opportunity for a person to really think through and make those decisions. We also want to plan for transitions and then document any options explored and the choice that the person made. So a lot of information in that. I assume that there are some questions that have come in through the Q&A panel. If you have not entered your question in the Q&A panel, now is the time. Please go ahead and type your question to all panelists using that Q&A panel at the bottom right-hand corner of your screen. And I will take a look through those and hand it over to my fellow panelists to answer. Fellow panelists, if you are answering, you are on mute.
Hi, Lauren. This is Sarah Boshen. We are working on the answer to one question that did come in, but we just need a few moments. So if you'd like to go forward and give us a time and one more opportunity at the end for the answer, that would be great.
Absolutely. Again, we've got one question being worked on in the background here. If you also have a question regarding the informed decision-making process or anything that we've talked about today or in our previous session regarding informed choice, now is a great time to put that in the Q&A panel. Okay, so I'm going to give my folks behind the scenes a little more time to work on questions that may be coming in. I just want to kind of wrap up by saying today we talked about the rights of people with disabilities, the rights of people in the aging population, and how they relate to informed choice and decision-making. People with disabilities and people of all ages, including those receiving the elderly waiver or our alternative care services, they all have the right to make choices. They all have the right to take risks and the right to live the life they want to live. The Informed Choice Statute lays out Minnesota's expectations for those who work with people with disabilities to ensure that we are protecting these rights for all of the people that we support. Informed choice is key to building a support plan that's meaningful to the person. So it's going to be a continuing topic throughout our series. A quick look forward into our next session. In August's Building Your Skills, Developing a Support Plan episode, we will explore the process of backup planning. Today, we did provide a copy of that backup planning guide, but we're going to really go through that process in next month's session. We're going to be sending out an e-list announcement as we get a little closer to the webinar date. And just to kind of put it on your calendars, that episode 13, is slated for August 30th, 2023. You can register for future Building Your Skills presentations on TrainLink as they come up. We also have rescheduled the remaining sessions for the remainder of the year. We were going to have sessions August, September, October, but we want to really take some time to develop these trainings, and so we want to space them out a little bit further. So we will still go forward with our session on August 30th. We will not have a session in September, but we will have a session in October on October 25th. And unusually for this presentation, we are going to be having a session in December. We know it's a busy month, but we hope that having it on December 20th will allow everyone to attend. So if you've got our dates already in your calendar, know that they have changed. The December date is not yet set up in TrainLink, but it will be shortly. So we'll continue to remind you as we move forward. So my wonderful panelists, do you have some questions for us that you'd like to go through?
I do. Thank you. Hi, everyone. Sarah B. again. We do have one question that states, can you summarize what conversation we should have if the person chooses to live in an institution? I think of institution as hospital, nursing home, etc. So remember that choice is really about presenting the available options to a person. So living in a hospital isn't a residential option, but a person may still have preferences about an institutional setting. So it's really about finding out what they prefer with that environment and having the team work on that. And that's really specific to each person, right? So a nursing facility, a nursing home may be an option given the person's needs. So what your job would be is to provide information on the services that would be provided in any facility, how life would change for them, kind of have those discussions about the differences about living in a facility, how their needs would be met or wouldn't be met if it is an available options. So also remember that relocation service coordination and also moving home Minnesota are two service options that you would provide to a person annually during support planning. And I'll pause and let any of my colleagues jump on and add to that answer if they'd like, and pass it on because I think we have another question that Megan is going to speak to.
Hi, everyone. Sarah, I think that was a really great answer and covered it. If people have questions about relocation service coordination or moving home Minnesota, there are, for relocation service coordinations, there's a CBSM page about that. So feel free to take a look and reach out to us with questions about supporting a person when they transition, if you have specific questions about supporting somebody. We did get another question that says, with regards to the 20 hours of annual training for case managers, does this go from July 2023 to July 2024, or when does that begin? That is a great question. So this is referring to, for those that may have missed the beginning, we had an announcement that there's a new legislative requirement effective July 1st that when a case manager works with a person on the BI, CAP, CADDY, or DD waiver, they now must complete 20 hours of case management training each year, which is an increase from the 10 hours per year that was previously required. And it's effective July 1st. So this new legislation is effective July 1st, but Case managers can complete the training annually or by calendar year, or really whenever the county or tribal nation requires that to be done. So I would just connect with your supervisor or lead agency, a county, tribal nation, to see kind of when they would require that annual training to be completed. I hope that helps answer the question. And again, for those that missed the beginning, if you have the slide deck, you can go on and look at that announcement. We're also updating the CBSM page to include this new training policy requirement. And I also want to again note that the Case Manager Care Coordinator Toolkit that is linked in that announcement as well is a great resource for training opportunities as well. So go take a peek at that for a bunch of good training opportunities to help meet the requirements in those specific areas. I'm not seeing any other questions at the moment, actually, so I guess I'll pass it back to you, Lauren.
Thank you, Megan. Thank you, Sarah. We will still have time to answer questions as it's only 11:05. So if you do have questions that you've just been kind of noodling on, please feel free to type those in the Q&A. We want to also take this as an opportunity to thank you all. You all play such an important role as you help people that you support make informed decisions while building their support plan. You are the ones to help ensure people live the life they want, and we want to make sure that we thank you for that hard work. I think I made a comment in our last session about needing to change this this picture because it was winter and it was ridiculously hot outside. I still intend to do that for the remainder of our ridiculous hot weather. I do want to draw your attention to the list of helpful resources that's at the end of every presentation. We do have some fantastic links here for you. Again, if you did register for this training, and that's how you got the link, there was an email sent out yesterday that has a PDF copy of this particular presentation, and all of these links can be clicked on the slides in that PDF copy. Want to also remind you that as we close out our presentation today, an external website will show up with our survey listed. It will show a little picture here, like we've got on the slide saying external site. We want to open a website on your computer. Promise it's nothing bad, it's just our survey. So if you can go ahead and click continue, that will get us to the survey, which now has 2023 dates in it. And you will be able to select the July 2023 presentation and give us your feedback. We really look forward to receiving that as it does help us to make these presentations better. And knowing that we are going to turn these presentations into online training, your feedback can be really impactful for folks who take this in the future. Remember, I know that we don't have any additional questions in the Q&A, but remember, if your question wasn't answered, or if you've got a question that just has been popping up in your head that's kind of tangentially, I'm gonna go with that, tangentially related, please feel free to send those to the appropriate division contacts. I do see Sarah's popped up on my screen, so I will let Sarah go ahead.
Yes, sorry. Our colleague, our support planning guru, Victoria Stelfox, she got kicked off of the meeting, so I'm kind of relaying her message related to the question about what if people discuss or do want to receive services from an institution, a nursing facility. And she wanted to remind you all that counties do have a form or should be using a form that states that the person is choosing to live in the institution and sort of waiving that annual assessment. And that form should indicate that the person can change their mind at any time and request an assessment to access services. So that's a reminder from Victoria.
Thanks, Sarah. Wow, sorry Victoria got kicked off. We try to be more welcoming than that. Wi-Fi, on the other hand, may not be. So to remind all of you, You can take a look at our training archive page in a few days, and you will find that today's presentation and webinar recording are posted. If you've got friends or colleagues that did not have a chance to attend this today, or someone that you think may benefit from hearing this presentation, then please do go ahead and view our training archive page. Send those remaining questions that you might have to our response center. And again, we just want to thank you for attending. Thanks for all that you do. Thanks for taking the time out of your mornings on the last Wednesday of the month to hang out with us. And we look forward to seeing you again this next month. Let's just double check in with our subject matter expert panelists in the background and see if there's any additional questions we should answer. Seeing none, I just want to wrap this up.
If
Go
you'll
ahead.
give us just one moment, someone asked about a form number and we are just checking to see if we can get some information. So just one moment.
No problem. Oh, I see that question now. Looking for a form number that Victoria was talking about for the form that you need to fill out for folks choosing to live in an institution.
Yep, so this is a county created form. So each county would have their own version of the form. But if you want more specifics, and Victoria's having some connection issues, reach out to us using the DSD contact form if you want more specifics about that. If your county does not have that form, and we can get back in touch with you.
Thank you so much, Sarah. The difficulties of Wi-Fi. All right, well, thanks everyone for attending our call today. I know that I really love bringing these to you each month, and I hope you're finding value in them. So please do join us again in August, and we will see you there.